The World Health Organization says the spread of polio is now a health emergency. That is just one of the stories we're talking about in our Health Watch today. Dr. Crystal Foster with the Baylor Medical System joins us. So bizarre, doctor. Polio had been eradicated years ago. Why this sudden outbreak?
And so the thing with polio, it wasn't completely eradicated. It was eradicated in the United States, but Pakistan, Afghanistan, and Nigeria still had polio up until a year ago. But now it's starting to spread outside their borders, partly due to poverty, partly due to refugees running from these war-torn countries. And so it's very easily transmitted in infected water, and we're starting to see cases where people aren't vaccinated, they're drinking this infected water, and it's spreading like wildfire.
Okay, can we still feel safe in America?
Partially. Now, if you're vaccinated against it, yes, you can feel safe against it. The vaccinations work against the current strains. However, there's a lot of parents who are not vaccinating their children for one reason or another, and those are the people who need to be concerned, especially if you come into contact with refugees from these countries.
Okay. All right. Something definitely to contemplate. Give a second thought to this, folks. All right. Another story making news today. The safety of baby gates. Turns out they're just not as safe as parents think. Exactly.
So there was this huge study at the Nationwide Children's Hospital in Columbus, Ohio. They looked back at baby gate safety from the last 20 years and actually showed that there are about 1,800 ER visits a year for children who are injured by baby gates. If children who are less than 2 tended to fall down the stairs because the baby gates either were improperly manufactured or not properly installed, children over 2 had soft tissue injuries, so they either got stuck in the baby gate or were trying to manipulate the baby gate and hurt their limbs or sometimes their head. So
but then you have to think of which is worse, tumbling down the stairs or just how about we're all a little extra safe when it comes to installing the baby gates?
Definitely read the manufacturing instructions.
All right, thank you. And there's an interesting study out today that some young blood may be able to improve lives. What are you talking about?
It's so weird. So there are 3 studies released through Harvard and Stanford, separate studies, that showed that mice, young mice who were surgically fused with older mice who shared the blood supply of these young mice, the older mice saw improvement in their heart function, in their physical athleticism, in their fur, and in their brain function. So there's something in the young blood of mice that is regenerating these older mice.
Okay, so let's apply that to humans. I'm not going to stitch myself up with anyone older or younger, and even blood transfusions. This might suggest something like that. It just sounds a little creepy.
It's different because the blood transfusion, it's not out of a living person. I mean, we took it out of a living person, but this had time to sit by itself. There is something unique about getting these live blood from a young person. So they are going to start studies on this in the next year or so. I doubt it's going to be surgical fusion at all. But
I hope I've long passed away before that ever comes into fruition.
They're looking at a protein. They think maybe it's a protein that's in it, so maybe you can isolate that.
Still interesting nonetheless. Thank you very much,
No
Dr.
problem.
Foster. Always great to see you.